Before starting any calculus removal, I will make sure that I have the correct armamentarium and PPE. Also make sure that I have the correct operator positioning ergonomics, with the equipment tray positioned within easy reach and the unit light at arm's length away. And I will move it into the correct archway and direct the light at specific treatment areas if needed. I will also make sure that the patient has the correct positioning ergonomics. I'll make sure that the chair is reclined and that the patient's head is even with the top of the headrest as much as possible. I'll adjust the patient's chair for height as needed and ask the patient to move their head in a way that makes sure that I'm able to see the specific area that I will be removing calc from. I will also make sure that I'm using the mirror correctly as needed for indirect vision, indirect illumination, and retraction and transillumination. First, I used the Gracie 1314 distally on number 3 for subgingival calculus removal. I inserted and used wrist activation to remove calculus in short biting strokes and longer strokes for assessment. I then switched over to the Gracie 1112 and moved across the surface towards the mesial. Again, short biting strokes for calculus removal. I did slightly slip due to not having correct finger positioning, but this can be improved by using a C shape instead of overlapping. To remove subgingival calculus from the facial surface of number 10, I used the Gracie 1-2. I inserted and then moved across, first doing surfaces away. I was again using my wrist instead of trying to digitate and using longer strokes for assessment and short biting strokes for any calculus removal. When I insert at the correct angle in order to have the correct starting zone, and then I get to the correct angle in order to remove calculus. So for surfaces towards, I repositioned my body, inserted the instrument, and started working across. I did slightly start to digitate at the end, which can be fixed by not doing that and instead doing wrist rocking. I then removed supragingival calculus from number 24 using an H67. I made sure to only use this instrument supragingivally, repositioned my body, worked across the surface, and short biting strokes again for calculus removal. Finally, I used the Nevi 4 for supragingival calculus removal of number 30. I first inserted distally and then went across in horizontal oblique strokes across to the mesial. I should have adapted and angled my instrument better towards the mesial to get the working end or edge used better, and the whole time I was using a steady fulcrum as well.